Using this abstract drawing of the face can be super helpful in reminding yourselves of the names of the cranial nerves in addition to some of their basic functions. So let's walk through how you can use this image. If we look at cranial nerve number 1, it's forming the nose of this face. That's going to remind you that cranial nerve number 1 is the olfactory nerve. The olfactory nerve is composed of sensory fibers only that's going to allow for your sense of smell. We could see cranial nerve number 2, the optic nerve, is forming the eyes in this face. That's to remind you that cranial nerve number 2 allows for us to have our sense of vision, so our visual sense, allowing us to see. You can see cranial nerves 3, 4, and 6 are forming the outer boundaries of the eye in this image. That's because these 3 cranial nerves, the oculomotor, the trochlear, and the abducens, are going to be innervating the extrinsic eye muscles, the muscles that allow for us to move our eyes in all different directions. More specifically, cranial nerve number 3, the oculomotor, is going to innervate 4 out of the 6 of those extrinsic eye muscles, including the superior, inferior, and medial rectus muscles, and the inferior oblique. In addition, parasympathetic fibers will travel along cranial nerve number 3 to go to the pupillary constrictor muscle and the muscle that's going to allow for accommodation of the lens when we are looking at things up close. We could see that cranial nerve number 4 is also innervating an extrinsic eye muscle. This one is called the trochlear nerve and exclusively is going to innervate the superior oblique muscle. Cranial nerve number 6 is also exclusively going to innervate one pair of extrinsic eye muscles, the lateral rectus muscles, and that muscle is going to abduct the eyes when it contracts, pull the eye laterally. So that is why it's called the abducens nerve. We can see cranial nerve number 5 is forming kind of the bulk of the middle face region. That's to remind you that the sensory fibers of cranial nerve number 5 allow for us to detect sensations from the skin of the face. For example, if you ever feel any bug crawling up the skin of your face, you are able to feel that because of the sensory fibers of cranial nerve number 5 carrying those sensations towards your brain. There are also motor fibers that make up portions of cranial nerve number 5. The motor fibers are going to be traveling to the muscles of mastication, allowing us to chew. So a muscle like the masseter, for example. We could see that cranial nerve number 7 is forming the outer boundaries of the face. We can see that front number 7 and then the backward 7. That's to remind you that cranial nerve number 7 is going to have motor fibers that allow for us to make our muscles of facial contraction, our facial expression contract. So in order for me to raise my eyebrows or to smile or to frown or to puff out my cheeks, all of those muscles are innervated by motor branches of cranial nerve number 7. But cranial nerve number 7 is also going to be carrying sensations from taste sensations specifically from the anterior 2/3 of the tongue. In addition, cranial nerve number 7 carries parasympathetic motor fibers to 2 of our salivary glands, or 2 of our pairs of salivary glands, the submandibular and the sublingual, in addition to the lacrimal glands, which are going to be producing and secreting tears. Additionally, we have cranial nerve number 8 forming the ears in this drawing. Cranial nerve number 8 is called the vestibulocochlear nerve, and the reason it's drawn as the ears in this picture is because the vestibulocochlear nerve is made up of sensory fibers only, carrying sensations that allow for us to hear and to have our vestibular sense. Then we could see cranial nerve number 9 found on the back of the tongue. That's because cranial nerve number 9, the glossopharyngeal nerve, is going to carry taste sensations from the posterior 1/3 of the tongue, in addition to innervating a number of the muscles that allow for us to swallow. Then we can see cranial nerve number 10 kind of in the anterior neck area near where the larynx would be. That's because cranial nerve number 10, the vagus nerve, is going to innervate some of our laryngeal muscles, allowing us to speak. Additionally, and maybe most notably, cranial nerve number 10 is going to be made up of a ton of parasympathetic fibers that are going to exit the head and neck area and travel down to the thoracic and abdominal cavities and innervate a bunch of the organs there, both from a motor standpoint and carrying sensations back up through that vagus nerve as well. Cranial nerve number 10 also will carry some taste sensations. So cranial nerves 7, 9, and 10 all are going to be carrying taste sensations from different parts of the tongue and mouth. Then cranial nerve number 11 is called the accessory nerve. We can see it's drawn kind of in the upper neck, upper back area here because that's going to remind you that cranial nerve number 11, the accessory nerve, is made up of motor fibers only, motor fibers that are going to innervate the trapezius muscle, this muscle here that then drapes over the upper back, and the sternocleidomastoid muscles, which are found in the anterior neck. Cranial nerve number 12, we could see drawn onto the tongue there because cranial nerve number 12 is the hypoglossal nerve. But it's important to remember that the hypoglossal nerve is made up of motor fibers only, and it is going to allow for movements of the tongue. Glossal, remember, whenever you see that term, some sort of relationship to the tongue. So here we can see that being the case with the hypoglossal nerve. So drawing out this picture and reinforcing the names of the cranial nerves and their main functions can be super helpful in your approach to memorizing, learning, and acing your exam on the cranial nerves. Make sure to like, comment, and subscribe for more videos on helpful anatomy and physiology tips and mini lessons, and hopefully making your journey in anatomy and physiology more fun and less stressful.